Now, if you are a baby boomer, having been born between the years of 1945 and 1956, listen up.
There is a silent disease you need to know about that oftentimes goes unnoticed for years or even decades. Take a look. Chronic hepatitis C, a serious, potentially life-threatening disease that can cause long-term health problems, affects over 3 million people in the United States alone. However, according to the CDC, up to 75% of those infected are unaware that their livers are slowly being damaged. Here with us this morning are Dr. Imtiaz Alam and recently cured patient Denise Curtice. Thank you so much for joining me this morning.
Good morning.
Thank you. Thank you for having us.
Now, Dr. Alam, let's start with you. What are some of the risk factors for hepatitis C?
So about 85% of people who are currently infected with hepatitis C infection are born between 1945 and 1965. If you're in that age group, our recommendation is that you go and see your doctor to get tested for hepatitis C. It's a simple blood test, and you will know within a few days whether you have the infection. Today is an important day because today is National Hepatitis C Testing Day. Most of the people who acquire this infection are usually people who have used intravenous drugs or shared needles in the past, have had tattooing done, or have had a simple blood transfusion before 1992. Unfortunately, most people do not know they have it because most people initially have no symptoms. But it is a fatal condition in some circumstances, and that's why it's important testing is necessary. So again, if you're born between 1945 and 1965, you should go and get testing done to see if you have the infection.
And doctor, are there any symptoms that somebody might notice if they do have this infection?
So most people do not know they have this infection, and often it's called a silent epidemic. The initial symptoms some people may have may be something as simple as fatigue or joint pain. If you don't know that you have it and you allow this infection to attack the liver, it can damage the liver by causing scarring, and in some circumstances some patients can go on to develop liver failure and liver cancer. That's why it's important that not to get tested based upon symptoms, but based on whether you're in that age group or you may have had some risk factors before. So go and see your doctor and get testing done, because there is a potential treatment that can cure you of hepatitis C, and that cure can be as simple as taking 1 pill a day for as short as 2 or 3 months with over 90% chance of being cured. And Denise has an excellent story she tells of her experience of going through this treatment.
Yes, Ms. Curtice, tell us, how did you find out that you were infected by this disease?
I had given birth to my first child. During childbirth, I had a blood transfusion, and I went later on to go get testing done for life insurance, just to find out that I was denied life insurance. Told that I had a situation that needed to be addressed by a doctor. I went to go see my doctor, and he told me that I had Hep C. So I had gone through treatment. I did it in 2005. I did it in 2007. Back then, in the olden days, that was 48 weeks per treatment. It was not successful for me. I still had Hep C until I heard about a new treatment. It was a pill a day for less than 12 weeks for me. And I was officially pronounced cured. So I highly suggest that you go get tested. Talk to your doctor. There's hope. If you have questions or concerns, there is a website that you can go to. Go to hepchope.com. So we encourage everyone, don't stay ignorant. Go to your doctor, get tested.
Excellent.
Take the drugs.
Well, I think that's excellent advice for our viewers this morning, and I want to thank you both for sharing this very valuable information.
Thank you so much.
Now, don't go anywhere. The Morning Blend will be right back after this.